Good morning, class. This is Principles of Health Science with Mr. Justice. We're going to be starting today in Unit 1. So for my class, for those of you who've not been able to pick up a book from school yet, that's okay. We're getting ready to go back to in-person classes. The 28th, this coming Monday. So you'll have a chance to get a book that you can take home, and of course we'll need to take it home, bring it back as each day that as we have school. But it'll be there and available for you. Now, this is the book, Diversified Health Occupations, for the class, Principles of Health Science, 6th edition. As we open up this chapter, I think goes from chapter 2 to chapter 24, and we're going to talk about healthcare systems. Some very interesting information. Now, I've already posted an assignment that you may see, so don't freak out. There are 8 questions there. It's got the point value assigned. I think the entire assignment is 100 points. There's some multiple points to certain questions. So as you look over those questions, this information will be contained, some of it will be contained in this lecture, I'm sure, and then also in the reading of the book. Now that you don't have a book, again, don't freak out. When we come in on Monday and we give you that information, give you that book, and you're able to take it home, you'll have time to complete this assignment. It's not a large assignment. You'll have time to complete that assignment by the due date, which is a week from this coming Friday. So as we let's get into the information here. Unit 1, systems, healthcare systems. You'll notice that on page 2 that you have the unit objectives for this unit, Unit 1. And then on page 3, we have the key terms. I'm not going to read to you word for word. This is something that you can do yourself. I'm just going to point things out to you and give you some certain information. And then as you go down, we start the history of healthcare. Now, when we talk about the history of healthcare, the first period that's covered in this is 4000 BC to 3000 BC. It's amazing to me of how far in technology that we have come and what we can do to aid and help people who are sick, people who are injured. As we look at the very beginnings that we have information on, they were very limited in their resources. But for this time period, where did illness and disease come from? When we think about it, we talk about microbes and viruses and fungi. Back then, according to this, they believed that illness and disease was caused by supernatural spirits and demons. So they didn't have any concept of a microbe or a microscope during 4000 BC to 3000 BC. Generally, the average lifespan, 20 years. Now, there was probably certainly people who lived over 20 years, some that may have not even, I wonder what the mortality rate during childbirth was during that time, but the average lifespan was 20 years. We go into the second time period that it covers, and it's 3000 BC to 300 BC. This is the ancient Egyptians. They were the earliest people known to maintain accurate health records, which is real interesting that we can go back and we can look at that information. Average lifespan, 20 to 30 years. They were still in that supernatural realm, and the fact that they called upon the gods to heal them when disease occurs. Now, as I go through the history of healthcare, there will be some point in this health science program that we'll talk about spirituality and what part that it plays in people's lives. That we understand that we have different cultures and different belief systems, but it plays an integral part in the whole person. And as we go through the book, we'll talk about holism. We'll talk about Maslow's hierarchy of needs as we prepare to care for people in the time that they're sick or injured. The next period, 700 BC to 220 AD. This is the ancient Chinese. There was religious prohibitions against dissection, resulting in inadequate knowledge of body structure. So they didn't believe that today we do autopsies. We have people who have donated their body to science, cadavers. We have people who, for healthcare professionals to study, for doctors, for nurses, to research, to help with caring for people who have an illness or have a certain disease. But back then they had prohibitions against it. That's something we're not going to do, they said. Average lifespan, we're living a little longer, 20 to 30 years. They used acupuncture and puncture of the skin with needles to relieve pain and congestion. And we use acupuncture today. There are modalities for acupuncture, acupressure, reflexology, alternative concepts and theories for helping the body to maintain. The next period, 1200 BC to 200 BC, we have the ancient Greeks, and they begin modern medical science by observing the human body and the effects of disease. Now, as I'm doing this lecture, I don't want to bore you. I'm going to keep the lecture to about 15 minutes, first part of the lecture, and I will stop, and then I will publish this, and then I will put it up. So this is Unit 1, Healthcare Systems, Principles of Health Science, Mr. Justice, and it'll be about 15 minutes as we continue. All right, just a little blurb there. They carefully monitor the pulse to determine the condition of the body, something that we do today. What's one of the first things they do? They check a pulse. Do you have a heartbeat? A pulse is a wave-like flow. When the heart beats, it sends it out, and we have pressure points where an artery crosses over a bone, and we're able to feel a pulse there, such as the radial pulse. In the arm, when they check a blood pressure, we check the brachial pulse. So we have the radial and we have the brachial. Anywhere there's a pressure point, a pulse point, we can feel the beat of the heart. As long as the heart's beating, we can feel that. Or unless there's some other type of hindrance that would cause us not to feel that. And we're able to judge how fast, what's the rate. The average adult pulse is between 60 and 100 beats a minute. So the Chinese were figuring this out, the ancient Chinese. Now let's go to the next, the Greeks. 1200 BC to 200 BC. And we've, actually, I think I'd mentioned that a little bit, but they continued Hippocrates, I'm sorry, the father of medicine. I'm having trouble pronouncing that this morning. They developed an organized method to observe the human body. They recorded signs and symptoms of many diseases. Stress, diet, and cleanliness as ways to prevent disease. Back then, they were stressing diet and cleanliness to prevent disease. Average life expectancy, we're going up. They're 25 to 35 years old was the average life expectancy. All right, let's take a look at the ancient Romans. They were first to organize medical care by providing care for injured soldiers. Early hospitals developed where physicians cared for ill people in rooms in their homes. Later, hospitals were religious and charitable institutions. They were housed in monasteries and convents. So you had the nuns and the monks taking care of those people. The doctors would come in, and they were providing care to those who were sick and injured. They began public health and sanitation systems during the ancient Roman times. This is 753 BC to 410 AD. Diet, exercise, and medications were used to treat disease. The average life expectancy, the average lifespan, again, 25 to 35 years. So let's take a look at historical events, time period, the Dark Ages. 400 to 800 AD. Emphasis was placed on saving the soul, and the study of medicine was prohibited. Prayer and divine intervention were used to treat illness and disease. Average life expectancy, 20 to 30 years. Monks and priests provided custodial care for sick people. Medications were basically herbal mixtures. Middle Ages, 800 to 1400 AD. A renewed interest in medical practice. Average life expectancy, 20 to 35 years. 1350 to 1650 AD, the Renaissance period. Average life expectancy, average lifespan, going up, 30 to 40 years. This was the rebirth of medical science. They began to study, looking at anatomy and physiology. Anatomy is the study of the structure of. Physiology is how does it work. In the 16th and 17th centuries, causes of disease were still not known. Many people died from infections. As apothecaries, early pharmacists, they made, prescribed, and sold medications. Now, one thing that I find interesting, we were in the 20-year-old at the beginning, average life expectancy 20, and then in the Renaissance period, we're starting to go 40, and now they're looking at 35 to 45 years old as the average life expectancy. So we see the effects of medical science on the human body. with the life expectancy going up. 18th century, life expectancy increased 40 to 50 years. We got the thermometer, created the first mercury thermometer in 1714. So that way we can test the temperature. I can't imagine how many people they tested in order to get an average. We say what the average temperature of a body is like 98.6. Now, since we are in COVID, let me take a moment here. Since we are in COVID-19 times with the pandemic, everybody's taking a temperature. Now, I was diagnosed, tested positive for COVID on July the 16th of this year, 2020. My temperature, one thing that I noticed, prior to that, when we would report to a building or to work, and we didn't have any students, but we were here, they would take our temperature. My temperature was like 97.2, 97.4, 97, 97.6 on average. I run 97. When I began to feel unwell on the Monday before the 16th, my temperature went up to 99.6, 99.8. So I went up 2+ degrees, 2.2+ degrees, and felt bad, felt really bad, had severe fatigue. I did not meet the standard for COVID at 100.4 or 100.5. I didn't meet that standard. Now, I was running a temp for me. 2.2+ degrees is an increase to what my normal body would run. So that's one thing that I paid attention to as I continue to feel sick, to get sicker. Sicker, that's probably not a word, sick. So we look at those. I wonder how many people they had to test, but the average is 98.6. But understand that there's some people who might run a little lower, a little higher, depending on the environment and the individual person. All right, so let's look at the 19th century. Royal College of Surgeons, medical school, founded in London in 1800. French barbers acted as surgeons by extracting teeth, using leeches for treatment, and giving enemas. Doesn't sound like any fun there. But understand that all this is in transition. People were trying to help people who were sick or injured or who presented with problems that they didn't know how to fix. And they were looking at ways to fix those problems. In the 19th century, there was a lot of discoveries made, which I think is awesome. Average life expectancy, 40 to 60 years in the 19th century. So let's move to the 20th century. Where are we at? Walter Reed demonstrated that mosquitoes carry yellow fever, 1900. One of the other things that I think is interesting, that in 1997, I believe it was, that Dolly the sheep was cloned. The first heart-lung machine was used in open heart surgery in 1953. So there's a lot of things that went on in the 19th and 20th century. Average life expectancy, 60 to 70 years. I think right now we're at the average life expectancy of right around, I think for an adult male is around 77, 78. For adult female, 78, 79. With the technologies and things that we have, I think that we can see better life expectancy. We can see more quality in life. But as we look through all this period, diet and exercise, taking care of ourselves is very important. We're at 13 minutes, 48 seconds. I'm going to just lecture for a couple more minutes, and then part one will be done as we go through the history of healthcare. Potential for the 21st century, cure for AIDS and heart disease. Genetic manipulation to prevent inherited diseases is common practice. It's some of the things that they're hoping for the potential for. Average life expectancy, 90 to 100 years and beyond. Antibiotics are developed that do not allow pathogens to develop resistance. That would be something that would be awesome. But we live in very different times. We're dealing with as I'm doing this lecture, we're dealing with a pandemic even as I speak. That's one of the reasons that I'm on a YouTube channel. That's one of the reasons that I'm trying to do lectures. I say trying. Please forgive my inadequacies. I may not pronounce everything correctly. May look a little funny sometimes. But we want to learn, because in learning, you are the next generation that will come after. You're the ones who will be the doctors, the lawyers, or any vocation that you may choose to work. So having knowledge is power. Knowledge helps you to live a better life. And then putting all that information into action helps that to become a reality for you. So these are things that they look at during the 20th century. Now, in part two, we will start private healthcare facilities. We'll talk about the different types of facilities. That's one of your questions that you'll see on your assignment. So I would like to, again, glad to have you in class. Coming up on Monday, I'll get to see your smiling faces, get to give you your books, and we can go over some information and kind of get our educational process back in the swing of things. I know this is difficult on you. It's difficult on us as instructors, but we want to see you learn. We want to see you be successful. So guys, that's it for me for Healthcare Systems, Unit 1, Part 1 of this lecture. Hope you all have a great day. See you.